I'll be covering three specific terms. 1. Biohazard. 2. Epidemic. 3. Pandemic. I will explain what those terms are, how they occur, and procedures that usually are followed in the event of a biohazard, epidemic, and pandemic. I will provide examples of previous diseases that relate to epidemics and pandemics. I will outline who is responsible to monitor and prevent these hazards. I'll explain what you can do in the event of an epidemic or pandemic, as well as some tips on how to prevent infection and its spread. The Oxford Dictionary reference for the term biohazard states a biological or chemical agent that is harmful or endangers life. Biohazards relate to pathogenic organisms, their cultures and tissue, hospital dressings and used needles. Objects that are contaminated with blood or other bodily fluids designated as hazardous waste. There are three types of biohazards. 1. Chemical, resultant smoke or exposure from a fire or an explosion. Chemical spills from an accident or even a terrorist attack. 2. Radiological. Australia does not have a nuclear power plant, but we do have medical equipment such as MRI and X-rays. If they are damaged, they can emit radiation which is harmful and can endanger life. Overseas, some warships run on nuclear energy instead of fuel. Therefore, a dangerous radiological leak could potentially happen and may affect many people. There are also some radioactive debris in space. It's possible that this debris may hit Earth and spread radiological biohazards. 3. Biological. Biological agents that could cause illness include anthrax or smallpox. People may deliberately release anthrax to cause illness. There are also many more causes of biohazards such as bacteria, fungi, or toxins, which can harm people or animals. There are two types of outbreaks. An epidemic is when a contagious, infectious, or viral illness spreads to many people in one specific geographic region. An example of an epidemic is the outbreak of the influenza during wintertime. Pandemic, a disease outbreak that spreads around the world. Most pandemics are new infectious diseases. Often there are no vaccinations or cure at the time of the outbreak. During the onset of a pandemic, usually research is conducted in order to find a cure, i.e. a vaccination. Or a previous infectious disease may reoccur. If there are not enough treatments to prevent it, another pandemic may follow. Pandemic outbreaks were previously slow spreading, taking 3 to 6 months, due to international travel being mainly by ship. Now outbreaks can spread quickly due to air travel, as infectious disease spreads across continents through human-to-human transmission. Who's responsible to monitor these outbreaks? The Department of Health and Human Services in each state are responsible to respond to chemical, biological and radiological emergencies. As well as working with other local agencies. The World Health Organization, WHO, established the Influenza Pandemic Alert System, which has a scale of 6 phases. Stage 1. A virus in animals is circulating. There is potential for pandemic outbreak. Stage 2. An animal flu virus has caused infections in humans. However, it has not spread through human-to-human transmission. Stage 3. Sporadic cases or small clusters of disease occurring in humans. Human-to-human transmission is insufficient to cause community-level outbreaks. Stage 4. The risk for a pandemic has greatly increased but not certain. Stage 5. Spread of the disease between humans is occurring in more than one country regional area, defined by WHO. Stage 6. Community-level outbreaks are in at least one additional country in a different WHO-defined region than outlined in Stage 5. This stage is considered a global pandemic. Epidemics and pandemics can occur anywhere in the world. I'll outline 3 notable examples of pandemics. One, in 1347, the Black Death resulted in 75 million deaths. 2, in 1918, the Spanish flu caused 40 to 50 million deaths. 3, in 1957, the Asian flu outbreak resulted in 2 million deaths. Three notable examples of epidemics are: 1. In 2003, SARS caused 800 deaths worldwide. 2. In 2009, the swine flu caused 284,000 deaths. 3. In 2014, the Ebola virus caused 11,000 deaths. What should you do? How can you avoid contracting or spreading an infection? There are prevention measures you can adopt. When you cough or sneeze, cover your mouth and nose with a tissue to prevent spreading the virus. Then ensure you disregard the tissue in the bin. Avoid retaining tissues as viruses can remain active on them for up to 12 hours. Avoid cloth handkerchiefs. Tissues are better as they can be thrown away after use. Wash your hands straight away with soap and water, or use an alcohol-based hand cleaner or gel sanitizer. You may consider wearing a mask to prevent receiving or spreading infection. Regularly wash your hands and use an alcohol rub to minimize risk. Always wash your hands after using the toilet. Also, when you cough, sneeze, or are in contact with someone else, ensure you wash your hands. If you're in contact with an infected person, do not touch your eyes, mouth, or nose until you've washed your hands. Wash your hands before preparing food. Viruses can stay alive on the skin for up to 30 minutes, infecting food or surfaces. which can then infect others who may ingest it. The best way to wash your hands is to use soap and water. Lather your hand for 15 to 20 seconds and then rinse off. Do not share things such as towels, bedding, toothbrushes, food, or drinks because viruses can stay alive for up to 12 hours. Keep your kitchen surfaces, door handles, and dining tables clean. Viruses can stay on these surfaces for up to 2 days. It's critical to ensure that everything is clean to prevent infection and spread. If you are sick, make sure you keep your distance from others, at least 1 metre away. Also try to avoid crowded areas, trains, shops or workplaces. If it is compulsory for you to go to work, consider wearing a mask to avoid spreading the virus or illness. Try not to visit friends or family if they have the flu, unless it is critically important. If there is a pandemic, what do I do? The more people are sick, the more people are absent from work, which affects businesses. Transport may be affected as there may be less people working. Telecommunication and electricity services may be affected. Those who can fix the power if it goes down may be unable to work. In the event of a pandemic, please try to stay at home to avoid getting infected. If you can, try to talk to your boss, and if you can, work from home so you can avoid the virus. Also, you need to prepare ahead, such as having learning activities for your children in the home, in case their school is closed. Make sure that you store extra water and food supplies to avoid a trip to the store, thus avoiding the risk of being infected. If you are generally healthy, not stressed, eating healthily and exercise regularly, this will mean that you have a better chance of resisting the flu. Try to help local seniors or senior family members and friends, as they may have a higher risk of contracting a virus. If the flu is known to be spreading and you want to go out, please make sure you wear a mask. If you happen to get the flu, there are vaccinations and antiviral drugs that can help you. With a 70 to 90% success rate. Nevertheless, it is very important that you do not go out when you are sick, or if you really need to go out, wear a mask. In summary, an epidemic is when a contagious, infectious or viral illness spreads to many people in one specific geographic region. A pandemic is a disease outbreak that is global. WHO keeps track of all viruses through their 6-stage categories and have an alert system. It is important to be aware of the stages of the virus. Make sure that you cover your mouth or nose if you're coughing or sneezing. Use disposable tissues and throw them away after using them. Wash your hands regularly and use alcohol rub to keep them clean and kill germs. Keep every surface of the house clean, such as kitchen surfaces, door handles, and so on, as this will reduce the germs from being present. To avoid being sick or spreading a virus, please wear a mask. Try to avoid going out. If you believe you're infected with an infectious disease, call 000 and stay home to avoid spread. Deaf people can call 106 using TTY or the National Relay Service via the internet or SMS to notify authorities. Agents can come and assess you, which will minimise the risk of spreading the virus.